In this video, we're going to talk about how you can estimate your medical bill before you get that procedure so you're not surprised when it's time to pay. Hey guys, and welcome back to my channel. If you're new here, my name is Shamy. I'm a healthcare finance professional, and this channel is all about helping you understand your health insurance to save money. So if that's something you're interested in, please subscribe down below. Like many of you, my doctor has recommended surgery or expensive procedures to help with a medical condition, and I was nervous about whether or not I could afford it and how much it would set me back. But I found that understanding and estimating my costs helped me decide whether or not to move forward, which I did in my case, and it helped me prepare financially once I did. I've learned a lot of tips along the way, and I feel confident that if I had to have surgery again in the future, I know how I would go about estimating those costs. So in this video, I wanted to share with you everything I've learned along the way. Of course, your health and medical decisions should always be guided first and foremost by conversations with your doctor. But if you want to be more prepared financially before you get care, then this video is here to help you plan ahead with confidence. Now, the first thing I did was check to see if my procedure was covered by my insurance plan. And the way I did that was I logged into my insurance company's member portal online, and I looked for a document called the plan document. And this document is usually a PDF. It can be several dozens of pages long, but the good thing is that it's organized by covered services, usually in alphabetical order, so you can just scroll down to the name of your procedure and see if it's there and see if it's covered. A pro tip is for the procedure you're looking for, you want to check to see what covered services your insurance company will pay for. And what I mean by that is that usually when you're having a procedure, it's not just the procedure itself, but it's the associated labs, imaging, and prescription medication that are bundled in having that procedure. So, I know some of you watching are probably parents and are struggling to conceive naturally, and a route you might be considering is in vitro fertilization. Well, in vitro fertilization is not just the IVF procedure itself, but it's several procedures in order to even get to that. So that includes the induction of ovulation and the medications associated with that. That includes the egg retrieval, the fertilization of those eggs into embryos, the freezing of those embryos, and then the eventual transfer into your uterus for pregnancy. So your plan document will outline all the different covered services for that procedure, which just helps you be more prepared to know what's covered. Now, the second step I took was estimating how much my health insurance company would pay for the procedure. And one way you can do that is by asking your doctor's office to provide you with the allowed amount for your procedure. And what the allowed amount is, it's the price that your doctor's office has negotiated with the health insurance company for this procedure, or the amount that your doctor will be paid for the procedure. And usually what your doctor's office will need is your health insurance card information and knowledge of the CPT code, which is a code that describes the procedure you're going to have and is used for billing purposes, which they can then use to call the health insurance company and get that allowed amount for you. Now, if your doctor's office is unable to do this, then what you're going to want to ask them for is for the CPT code of the procedure so you can look this up yourself. And you can look it up using a healthcare cost estimator tool such as fairhealthconsumer.org, which is a tool that allows you to plug in your CPT code and your zip code to help estimate the cost of your service by looking at how much it's usually charged in your area to provide you with an average in-network and out-of-network cost. Now, if you don't have health insurance or plan on paying for this procedure with health insurance, you're going to want to ask your doctor for what's called a good faith estimate, which is an estimate of your procedure that protects you in the case that your medical bill ends up being more than $400 over that estimate. Because according to the No Surprises Act of 2022, consumers have more protections against surprise medical bills, and one of them is surprise medical bills, which are over $400 of that good faith estimate for patients who didn't pay with insurance. And if unfortunately that does end up being the case, then you want to file a complaint with the Centers of Medicare and Medicaid Services to report that doctor or hospital for not following the rules. Now that you understand that this service is covered, and you understand the allowed amount for the service, the next step is understanding what portion of the allowed amount you're responsible for, because the allowed amount is a combination of the patient's responsibility and the health insurance company's responsibility. And in order to calculate your portion, you're going to want to know your plan's deductible and out-of-pocket maximum, as well as the copay or coinsurance for this procedure. Let's walk through an example together. Let's say that the allowed amount for your surgery is $15,000 and your plan has a $2,000 deductible, a $5,000 out-of-pocket max, and a 20% coinsurance on surgery. If by the date of your surgery you've already paid $500 towards your deductible, you'll be responsible for the first $1,500 of your surgery by yourself in order to hit your $2,000 deductible. So after you pay $1,500 of deductibles, the remaining $13,500 of your surgery is subject to a 20% coinsurance, which is $2,700. Now, to determine how much of the coinsurance you'll have to pay, let's check in on where you are with your out-of-pocket maximum. So far this year, you'd have hit your $2,000 deductible, which means you don't have to pay more than $3,000 total in medical expenses for the rest of the year. And since the coinsurance is $2,700, you'll pay that amount in full. So the total cost of the $15,000 surgery is the $1,500 deductible plus the $2,700 coinsurance, or $4,200. But let's say your plan has a $4,000 out-of-pocket max instead. How much does your procedure cost now? Well, you'll still pay the $1,500 in deductibles, and the coinsurance for the surgery still calculates to $2,700. But since you'd already have paid $2,000 in deductibles, you can only pay $2,000 more in copay or coinsurance, so you'd only have to pay $2,000 in coinsurance rather than the full $2,700. So the total of this surgery is the $1,500 in deductibles plus the $2,000 coinsurance, or $3,500 total. If you want to learn more about terms like copay, coinsurance, deductible, and out-of-pocket max, don't miss my video on how health insurance works. It walks you through the basic health insurance terms to help you feel more confident about reading and understanding your plan. Thank you so much, and I'll see you in the next one.